So our next speaker is Wendy Xia, and if you want to come on up, Wendy. The title of the talk is Connecting Our Community to Physical Activity, Development of Ready-to-Use Infographic Resources within the Promote PA trial. There you go, Wendy.
Thanks. Good afternoon, everyone. My name is Wendy, and I'm a research assistant from the Institute for Musculoskeletal Health. Today, I'm presenting on behalf of the Promote PA team on the topic of connecting our community to physical activity, the process of developing ready-to-use infographics within the Promote PA trial. We all know that physical activity is important for healthy aging and falls prevention, and health professionals are key promoters of physical activity. I'm supporting a research study, Promote PA, that aims to evaluate the impact of physical activity promotion of health professionals on the physical activity levels of patients. And in part one of the study, we interviewed health professionals, patients, and community physical activity providers, and they described a range of perceived barriers. For patients, cost and transport are major barriers, along with beliefs around physical activity and pain. Health professionals face barriers such as lack of time, limited trust in community physical activity providers, and difficulty accessing up-to-date local information. And on a system level, there's limited suitable physical activity providers out in the community, and also limited access to appropriate equipment and gym spaces. In part two of the study, we conducted a hybrid type 1 effectiveness implementation cluster randomized control trial. We randomized 32 teams across different local health districts, and the main service types include physiotherapy outpatient department, aged care, pediatric team, and OACCP. Despite the long name, the study design is actually relatively straightforward. We recruit clinical teams and randomize them into either the early or the delayed implementation support group. For the early group, they will receive implementation support straight away before they start patient recruitment. And for the delayed team, they will start recruit for patient first and then receive implementation support after 3 months. For patients, they complete surveys at baseline, 3 months, and 6 months follow-up. We hope to support physical activity promotions in different ways by offering a menu of implementation support strategies for clinical teams to choose what works best for them. And the main focus was the education, training, and resource hub. As we were engaging with health professionals and delivering the implementation support, we found that clinicians often face time constraints in day-to-day practice, and the local physical activity information is scattered across multiple sites and presenting in different formats. This quote here shows you how clinicians need to do multiple searches to identify suitable physical activity options and how valuable the information is for their patients. It suggests that the need for something that's quick to access, visual, and also easy to share. So we came up with the idea of developing ready-to-use infographics. We're not to create more information, but to make existing information accessible. We've developed both clinician-facing and patient-facing resources during the study, but today I'll be only focusing on the patient-facing resources. We adopted a co-design approach so that the resources we developed are ready to use in routine practice. We started with identifying content that are based on patients' interests and needs. For example, for patients that are interested in using the council outdoor gyms and they're unsure of where to find them, what equipment is available, and how to use those equipment safely. We then shortlisted some resources and community exercise programs, and these went through rounds of feedback for layout and content. We then uploaded the finalized version onto the Promote PA website, and we aim to review them every year. We also share these infographics with the consumer advisory group on the study, and they really liked the idea of having locally relevant resources for clinical teams, and they felt like it would make it easier for people to know what's actually available in their community. And I'll explain a bit more about how this process is informed by clinical practice. Clinicians identified key considerations for layout and content. For example, improving the readability for older adults. They also mentioned that it is helpful to speak to patients about the success stories of other patients. And since many community programs are term-based, they're finding it difficult to keep up with the frequent changes to local information. And in response to these priorities, we increased the spacing and font size of the infographics. We also included programs that are previously attended by other patients, and we included the QR codes that links directly to the council websites. During the study, we have more than 10 clinical teams that actively contributed to the co-design process, and we created over 60 infographics covering outdoor gyms, community exercise programs, walking groups, and other local physical activity opportunities across many New South Wales local government areas. And I'm excited to show you some examples of the infographics we created. The main series focus on the free resources like outdoor gyms, walking groups, and park runs. For community exercise programs, we also have, like the one on the right, the aquatic exercise, and we have relevant cost information on the back of the page. We also develop fact sheet style infographics, such as how to use wearable devices to track physical activity, exercising with osteoarthritis, and inclusive sports and recreation opportunities for children with disability. And for the How to Use Outdoor Gyms flyers, we specifically included photos of older adults and adolescents using the common gym equipment to help increase patient confidence. The study is still ongoing, and we are seeing some early indications for impact in practice. And just to be clear here, the infographics is only one component of the implementation support. So the snapshots of data here only illustrate the impact for practice rather than the effectiveness of the intervention. We conducted interviews with clinicians as part of the trial evaluation. And clinicians found that the infographics was really helpful in reducing the workload for them searching for suitable physical activity options, and patient was grateful to have something tangible like a printout. And one physiotherapist was really excited that her patients actually went out to the local parks and was doing some physical activity there. We're also seeing some positive patient outcomes. For those who have completed their 6 months follow-up, 52% reported that their health professionals has handed them a handout on physical activity, and 29% reported receiving a referral to a exercise, walking or sports group, and 40% reported joining one of those over the past 6 months. What we've learned from this process is that challenges still exist in bridging the hospital and community spaces for physical activity. And co-designed resources support clinical practice by reflecting and addressing both patients and clinician needs. There's a good uptake of the ready-to-use infographics as quick and practical tools in clinical practice. We found that consolidating relevant and local information is really time-consuming and labor-intensive. So we hope to develop the smart, centralized resource hub that streamlines the updates. And we're also exploring additional resources for the culturally and linguistically diverse population groups to support both physical activity and the social support aspects. In this initiative, we mainly work with health professionals, but increasing the engagement with consumers and local councils will be important to strengthen community partnerships and also making better use of what's available in the community. Supporting physical activity doesn't always require new programs, but better ways of connecting people to what already exists. And I'd like to acknowledge the Promote PA study team, participants, investigators, and local councils for their contribution. Thank you.
Excellent. Everyone's doing really well with time. So again, we've got time for questions.
Hi, great presentation. I'm just wondering, you're doing these infographics, where are you going to be able to access them by clinicians and even individuals in the community as well?
Thanks for the question. So at the moment, because the study is still ongoing, so the access to those resources are only limited to the participating clinical teams, but we do hope to disseminate them once the study is finished. I do have something to share, as in I think a lot of us are familiar with the Active and Healthy website. The one on the left, Robinhood, it's like a search engine for outdoor gyms. You can put in the postcodes and you can search for what's available around you. And the one on the right is the Links community directory that's managed and updated by local councils. So that's what I can share at the moment. Yes.
Thank you.
You did mention that when you did some qualitative work with the health professionals, trust was one of the issues. So trusting, where do you refer your patient to? So how did you go about picking which services to put on these infographics or flyers? Thank you.
Thanks. So this is how the co-design process that come into place. So we actually sit with health professionals during the early stages of the implementation support. We ask them about what services they want us to include in the flyer because they will be using those flyers with their patients. Also, we arrange meetings that between some community physical activity providers, sitting down together with the health professionals and see if that's something that they would be keen to refer their patients to.
Excellent. Well, you answered my question because I thought you were talking about the QR codes talking to council websites. And I was going to ask, where's the healthy and active, but it's right there. So,
Thank you.
Thank you so much.
Thanks.
Excellent.